For a number of reasons, including people with Parkinson's own struggles communicating and insecurities about their environment and their abilities, they tell us that they often feel misunderstood in a care setting. Difficulty communicating, both verbally and non-verbally, is often frustrating for the person as their minds continue to be active while their bodies do not always let them express themselves. Remember that just because someone's body is changing, it doesn't mean that their mind or that their attitude necessarily has. Rigidity, slowness, stiffness affects all the muscles from head to toe. Slowness of movement, slowness of thought, difficulty with swallowing, and it also affects those muscles that are related to facial expression. I'd like you to try another little exercise with me. Please take your hands and put them on your cheeks, and pull back tightly on your cheek muscles for me, and hold that for a moment. And now, I want you to smile at me because you're so happy to be learning about Parkinson's today. Right, and it's difficult, isn't it? I'm assuming there weren't a lot of bright teeth in the room. That doesn't mean that you didn't want to smile or express yourselves, it just means that your body was giving you a little difficulty when doing that. And that's just something to keep in mind in relationships with people with Parkinson's. Taking this a step further, I want to emphasize the importance of communicating with people living with Parkinson's and their families. A lot of times, people have been managing their condition for, say, 15 years on their own effectively, and they know all about the person's individual experience with Parkinson's, their individual response to medication, and how to best overcome a freezing episode, for example. Either with regard to timing or feeling an off period coming, the person with Parkinson's and their family are knowledgeable about when a patient will need their next dose. Understanding someone's normal medication regimen can help avoid unnecessary complications and prolonged periods of disability. Please consider implementing a patient's normal medication regimen into their care plan. As far as the individual symptoms go, there really isn't a lot that I can say as everything is very individual. With tremor specifically, try to remind the person to focus on one task at a time. Keep in mind that stress, fatigue, or underlying illnesses can worsen the symptoms. Consider the use of assistive devices that can help with activities of daily living. In consultation with a physiotherapist, please try to find an exercise routine that someone can do every day. Muscle relaxation techniques are often helpful. Remember the importance of medication timing around meals and medication timing generally. I won't go into great detail on falls, as I'm sure you have some best practices in place that work for your facility. Specific to Parkinson's though, one thing they're prone to is nocturia, urinary frequency, particularly through the night. If the person has the urge to go to the washroom overnight, consider installing a nightlight, making use of a bedpan or some other option, and try to be sure to help the resident with toileting before bed, avoid liquids late in the evening, and consider some environmental cues or markers in the room to help keep them safe. We've talked about how rigidity and stiffness affects all the major muscle systems. It also affects those that are related to eating and swallowing. Here's the easiest way to put it. If you try to feed a person with advanced Parkinson's without their medication working effectively or without them having had their meds, they're very likely to choke. The muscles in the throat are slow and rigid as well, and the normal muscular reflexes that prevent choking and prevent food and water from going into the lungs are also affected. That's why we're particularly conscious about medication timing around meals, and it's why we're hoping you will be as well. In closing, all that we're asking is that you consider the information and the difference that it can make for people living with Parkinson's and for yourselves, and that you find a way to make this work at your facility. Please make use of the kits, use the stickers, and find a way to make sure that everyone knows the importance of medication timing for people living with Parkinson's. I thank you for your time.
My name is Elaine Connor. I was a caregiver for a very good friend who had Parkinson's for 17 years. So we got to know a fair bit about medication and its effects and its side effects, and we were always very careful to try and keep it on time, all the time. She went into hospital for surgery after a fall, and subsequently she went to the rehab area nearby. There, the doctor instantly changed her medication schedule by cutting the dosage and changing the times. Despite my loud protests, his attitude was, I can't have my staff doing a schedule like that. They've got other things to do. In 2 days, you could really tell the difference. Her energy was down, her mobility was down, and her well-being was just not good at all. They added a little back, but it wasn't well placed, and she went to the other end of the short dyskinesias. Over a few weeks, she was battling other conditions and other drugs while she was not getting the full strength and energy and stamina that she might have had from these Parkinson drugs. So it was a real struggle. Finally, she had a severe stroke from which she never recovered. Now, I can't say, I'm not saying that this fluctuation and change in Parkinson medication was the sole factor or the only factor in this situation at all. But it certainly didn't help. It caused her a great deal of discomfort, and it certainly increased the stress level of all the rest of us. Just keep in mind that a Parkinsonian lives with a professionally, individually tuned medication schedule for good reason. Please follow it.